Good morning, good afternoon, and good evening, everyone. I'm Colleen Fitzwater. I'm the Communications Director for the Lobular Breast Cancer Alliance, and this is our fourth in a series of advocate chats, and this one is called, as you can see on the screen, Advocacy Through Supporting Others. And what I'll do is take you through just a couple of housekeeping items for today before we get started. And it looks like we're having a little trouble advancing the screen. There we go. So here's some information about today's session. The first is I did mention, we are recording now the presentation, and this portion will be recorded and everyone will be muted. And then when we get to the question and answer period, that is not going to be recorded. So what we're going to ask you to do is, if you have a question that comes up, if you're thinking about a question, go ahead and write it in the chat box, and I'll be taking a look at those throughout the session. And then during the Q&A portion, I will read those questions from the chat to our presenters to be answered. And again, I may also call on you if it's not quite clear what you're asking, or if you have a follow-up question, I might, depending on time, call on you to speak directly to the presenters. And then finally, we just always like to note to please avoid any questions about personal issues or specific medical questions. Unfortunately, they just can't be addressed during these types of events. So what I'd like to do next is introduce you to today's presenters. We're so excited to have all three of them here. So the first is Lori Petitti, and Lori is a 10-year lobular breast cancer survivor, and she's a founding member of the Lobular Breast Cancer Alliance. She's a graduate of NBCC's Project Lead and annually attends the Leadership Summit and lobbies on Capitol Hill for breast cancer research funding. She has participated as a consumer reviewer for the DoD Breast Cancer Research Program since 2017 and is an active advocate in several grant proposals. Lori also mentors newly diagnosed patients for both SHARE and ABCD, which you're going to hear a little bit more about in a moment. Next is Dale Semler, and Dale is the Breast Cancer Helpline Manager at SHARE. She received her master's degree in materials engineering from Rutgers University and her BA in psychology from the State University of New York at Binghamton. And after a long career as an engineer and a social media marketing manager, which is very interesting, Dale, she was looking for a meaningful job, she says, to feed her soul. As a 14-and-a-half-year breast cancer survivor, Dale knows the feeling that one gets when they hear the words, "You have cancer," for the very first time. Finding SHARE and the position of Breast Cancer Helpline Manager was the perfect fit for her skills and her desires to help others facing a cancer diagnosis. She's thrilled to be part of the SHARE team and to have the opportunity to make a positive difference in the lives of others. And then finally, let me introduce you to Betsy Bryant, who is ABCD's Senior Program Specialist. She came to ABCD after breast cancer diagnosis as a part-time match specialist in 2012, after completing her capstone certification in patient advocacy with the University of Wisconsin at Madison. Patient advocacy was a natural fit for a midlife career after overseeing the care of her elderly bedbound father. Playing a key role in the restructuring of ABCD's mentor training program, Betsy's role evolved to program specialist, along with the director of program services. Betsy was responsible for revising and redeveloping the new mentor training program, ensuring it provides a quality training experience for ABCD's new mentors. During her 9 years at ABCD, Betsy has become an integral part of the program services team. She's developed a strong bond with the ABCD Mentor Corps and is committed to creating the best matches for both the mentor and those who reach out to ABCD for emotional support, as well as exceptional new mentor training for the volunteer trainees. Betsy feels a strong personal connection with the mentors and those that ABCD serves. Thanks to all three of these ladies for being with us today. Lori?
Thank you. Thank you for having me today. I looked up a couple of definitions, and the definition of mentor is a trusted counselor or guide. The definition of mentoring is making yourself available to support and advise and delivering the support in a way that makes sense to the mentee and keeps their best interests in mind. And I really couldn't have said it better myself. That sums it up quite well. My mentor journey actually began when I was diagnosed in 2010 with stage 2 lobular breast cancer. There seemed to be this huge sense of urgency for me to have surgery. So I met with the breast surgeon and she went over the options, but I felt like I didn't have the ability to ask her good questions to make my choice. So that night I went home and I started Googling questions about surgery, how to find answers, all kinds of things. And I lucked upon a support group meeting that evening in my town. And it was for early stage breast cancer patients. And so I went. It was the best thing I ever did. I talked to 6 or 8 women who had breast cancer. They shared their stories and they allowed me to ask questions. I went home and I emailed my friends and colleagues and said, if you know anyone that's had breast cancer, will you ask them if they would talk to me? And I did. I talked to 4 additional women. They told me their stories and I asked them questions. So when I went back to my breast surgeon, I felt finally I could make an informed decision. I never forgot the power of that one-on-one of talking with people who actually had breast cancer. So cut to 6 years later, I know that I'm going to retire and I want to do advocacy work. So the first thing I do actually is attend a conference, and it happens to be the first ever lobular breast cancer symposium in Pittsburgh. And there were about 30 advocates at that conference, and they became the basis for the Lobular Breast Cancer Alliance. And one of the advocates told me about ABCD. So when I went home, I reached out to ABCD and I trained in Milwaukee in November of 2016. Over the course of my advocacy, I learned about SHARE and met some people from SHARE, and I did the SHARE training in early 2019. Next slide, please. So over the course of the last 4.5 years, I've spoken with a lot of patients, and each one is really unique. And each experience is a great learning experience. So I thought I'd share just some of the techniques that work for me. And the number one is to be prepared. So I'll get a call from ABCD or SHARE about a potential mentee, and I have a dedicated notebook. I write down notes about the person I'm going to speak with. And when I speak with them, I continue writing notes. And my notes are, the day, the time, how long we spoke. Oftentimes I'll speak with them several times, and it really helps to be able to go back and refresh my memory. So we're not rehashing old things, and I can help trigger questions for them about maybe upcoming appointments or treatment protocols that they were looking at. Another thing that's really important is knowing your communication style. So in one of the training sessions, we kind of very broadly grouped everyone into 4 communication styles. The analyst, who is kind of just the facts, ma'am. The amiable person who really just wants to talk and is very broad and easygoing. The expressive person who has strong values and opinions, and the driver, kind of the business-like person. Now, I know that I myself am kind of a hybrid of the analyst and the driver, and it totally makes sense. I was a producer in television, and I was responsible for bringing the project home on time, on budget. I plan, I solve problems, I ask a lot of questions. But the people I talk to are not necessarily my same personality type. So it's really important that I go to my next technique where I encourage them to speak and ask open-ended questions so I can learn about them and respond appropriately. My go-to question is, how can I help you? And, it's a nice open question that really allows people to think, what is it I would like help with today? And it's been very successful to me. I also try to really listen. Now, this is a picture of my dog, Cooper, and I think in this picture, she's really listening to me. It doesn't always happen because it's really easy to not completely listen to people. It's easy for our minds to wander. But when we really listen, that's when we can help uncover needs and concerns and help these mentees and these patients get to the root of what it is that they're looking for that could really help them. And finally, silence can be golden. We always have a tendency to kind of fill up every second of our conversation, but just taking a beat, especially, a lot of these conversations can be very emotional. So just taking a beat sometimes can really allow both the patient and myself to think about further things that we can discuss that would be valuable for both of us. Next slide. So that's how I mentor, but I think what's really the most important about mentoring is the rewards. And it's true, it's better to give than receive. I always feel so good after a call. And I guess I remember that one-on-one that I had when I was initially diagnosed. I remember how important it was to talk to somebody who'd been there, done that. I had great support from family and friends, but they didn't have breast cancer. And it's just different when you can talk to somebody who has gone through it and come to the other side. Also, understanding your communication styles and being an active listener really just enriches all relationships. I think about that dog. I'm constantly trying to communicate with her and constantly trying to listen to what it is that she thinks I'm saying or what she needs. And one of the greatest learning opportunities from mentoring is that it works for my breast cancer research advocacy work. This is a picture of me with Rebecca Riggins, who is a researcher at Georgetown University. She studies lobular breast cancer, and we served together on the Department of Defense Breast Cancer Research Program on a peer review panel. Now, my job on the peer review panel is to bring the patient perspective. So the more patients I talk to and the more I learn from them, I think the better my advocacy work can be. I was diagnosed almost 11 years ago, and things change. Treatment protocols change. There's new research out there. Imaging has changed. Surgical techniques, certainly reconstruction techniques, have really changed. So I learn, and learning and bringing that patient perspective to research advocacy work can be very valuable. So that's kind of a brief overview for me on what mentoring is. And I would like to turn it over to Betsy Bryant at ABCD.
Thank you, Lori. That was wonderful to hear. Can everybody hear me? Good. My role at ABCD is the Senior Program Specialist, but the main role that I fulfill at ABCD is matching. And I had the pleasure of being part of Lori's training as a mentor, and I really enjoyed hearing what she had to say about her mentoring experience and the training that she did with ABCD. So I want to tell you what we do here at ABCD, what our mission is, and explore some of the information that I can provide about ABCD. So what is ABCD? Well, we are a customized one-to-one breast cancer support organization. We know anecdotally that being able to talk to somebody who's gone through a similar breast cancer experience, like Lori explained, really does help a person be able to understand more about their situation. But decades of research have indicated that it does help people in other ways as well. People are more likely to finish their treatment and have improved survival rates. It also reduces the risk of recurrence to have support while you're going through a breast cancer diagnosis and have someone that you can talk to. And you have less stress in your during your experience, healthier social relationships, and improved quality of life. ABCD services are free, confidential, and always available. Next slide, please. So who are we and what do we do? Well, we are a nonprofit. We were founded in 1999 and based in Milwaukee. We offer free, personalized, one-to-one emotional support to all those affected by breast cancer. And because of the internet and because of the way the world is now, we are able to provide this support to anybody, anywhere, not just in Milwaukee, not just in Wisconsin, throughout the United States, and even throughout the world. We've made matches in India, in Saudi Arabia, England. So because of the fact that we are a telephone-based, internet-based organization, we've been able to reach far and wide. Our signature service is one-to-one mentor matching or match mentoring, peer support. And we work as a complement to a breast cancer patient's medical team. We have a very good working relationship with most of the healthcare systems in the greater Milwaukee area and most of Wisconsin, and now in some other states as well. They understand that we don't step into the medical advice giving lane. So they understand that we are not going to interfere with their patients' treatment. Our mentors do not give them medical advice, it's emotional support. So they feel comfortable referring their patients to us for emotional support. And we do get referrals from quite a few healthcare professionals. All of our services are free, and it can be anybody, patients, families, friends, caregivers. So anyone who's been touched by a breast cancer diagnosis can avail themselves of the services that ABCD provides. Next slide. We have a rigorous mentor training. Currently, ABCD has about 244 active mentors, although this number fluctuates depending on whether mentors want to take some time off. We do offer that option to our mentors. We want to make sure that they are practicing good self-care. So if a mentor has a lot going on in their life, or they have quite a few people that they are actively mentoring, they can choose to be inactive for a brief period of time or a longer period of time. So that number can fluctuate depending on who is inactive and who is not. We are always looking for new mentors, and all of our mentor applicants, with the exception of metastatic breast cancer patients, have to be at least a year out from their last active treatment date. This does not include hormonal treatment. So this would include radiation, surgery, chemotherapy, those kinds of things. If they're at least a year out from that treatment, they can apply to become a mentor. Then they must go through 2 interviews prior to training to determine if they are ready to mentor. We want to make sure that they're not only physically healed, but they are emotionally prepared to support someone else. Each trainee must complete 12 hours of professional training before they begin mentoring. And I will go into some of that in the next slide. Maybe a little bit later, sorry. So HOPE is customized to the participant. And let me explain a little bit. Participant is an internal term that we use at ABCD. It actually means mentee, or the person who's being supported. If I talk about a participant, that's what I mean. Other organizations may use mentee. We use participant, and it's only an internal term. All of our referrals are matched with a staff-trained and supported mentor who shares a lot of similarities. We match based on their diagnosis and treatment. So if somebody has invasive lobular breast cancer, we match based on that, their stage, and their treatment if they know what that treatment is going to be. We're also very careful to match based on age and life stage. So if there are certain things going on in that person's life, such as caring for elderly parents or raising young children or teenagers, and that's important to the person who's reaching out for support, we make sure to take that into consideration. Other interests that are important to that person will be taken into account as well. Next slide. How are matches made? All match requests must come from either a healthcare provider or be a personal request from the actual cancer patient themselves. We do not cold call anybody. If somebody reaches out to us and says their sister or their mother or their friend really needs support, we tell them that we must hear directly from that person. So we cannot reach out to somebody who has not been referred by a healthcare professional or from the person themselves. A match specialist, such as myself, will reach out to that person once referral or request has been made. And what sets ABCD apart from other organizations is that we match on the personal concerns of the participant as well as the diagnoses. Personal traits that we match on are age, marital or relationship status, number and ages of children, profession or job, homemaker, whatever that person is doing in their life that's impacting their diagnosis is taken into account. Interests and hobbies. Now, that is important because if a person has a very active hobby, such as running, working out, or they do a lot of lifting, that's going to be important to be matched with somebody who has a similar lifestyle. For instance, if their surgery is important, if this might become important so they know how to get back to doing what they like to do after surgery or after treatment. Religion and faith is also taken into account. If they have a strong faith or religion, but they prefer not to be matched on that, that's fine. But most importantly, we do a long intake with people to make sure that we cover what their concerns are. So it's not just the demographics that are taken into account, it's also what is on your mind that has the most concern for you in being matched with somebody. And sometimes it's decision-making. Sometimes some of the people that call us are just trying to make a decision about surgery or about reconstruction. Those are important too. And all of our matches begin with a phone call. Next slide, please. When are mentor matches available? This is a question that comes up, believe it or not, from healthcare professionals and people that just are generally interested in ABCD. A mentor can be matched with somebody at any point in time, whether a person is newly diagnosed or whether they're several years out from their diagnosis and treatment. There are times when someone is worried about recurrence, and they might be 3, 4, 5 years out from their diagnosis and they're still struggling, or an anniversary is coming up and they're worried, excuse me, they're worried about a scan or or an appointment, and they feel that they might need to have someone to talk to. There's no time parameter. There's no timeline on when somebody can be matched with a mentor. We also have mentors who request to be matched when they're considering having a surgery. They can be matched with one of our mentors. So that happens too. All of our matches are made within 24 to 48 business hours after the intake has been done. Next slide. So our match process, as I've stated before, every match begins with a referral. We contact the person once they've indicated that they would like to be contacted to go through an intake. We contact that person. We make a phone call, an email. We make sure that we set up a good time to talk with them that works with their schedule. We take all the information, including their diagnosis and treatment, as well as whatever personal information. I do want to mention here that if there's some information that the participant prefers not to share, that's fine. We don't ask them to give us any information that they're uncomfortable sharing. All we need is a first name and contact details to be able to match somebody, and then of course, whatever concerns they have. We want to make sure to protect their confidentiality. The information is entered into a database, and then that information creates a list that the match specialist can choose a possible mentor from. And then once we look at that list of mentors, we go through them person by person to determine who the best mentor would be. And it's not just their diagnosis, it's not just their treatment, it's also those other personal details. And we look at the information that the mentors have shared from the medical application or the medical profile that they share, and also other personal details that they share. So we make sure that we can do a very personalized match. Once the mentor agrees to the match, they are given all of the details of the participant's diagnosis, treatment, their personal concerns, and information on how to reach them. These days, we are connecting people mostly by text. The mentor sends a text to the participant to set up a mutually agreeable time to connect. And the participant is then contacted and given the first name of the mentor and the reasons why they were matched and all the information that we have available to share with that about that mentor. Next slide. I just want to mention too that our goal is not only to make sure that the mentor has, that the participant has a quality experience. We also want to make sure that the mentor has a quality experience, because as Lori mentioned before, it has to be a rewarding experience for both parties, for both people. So that is why we try to do such a personalized match and make sure that the match is a good one, is a quality match for both parties. That way the participant benefits, the mentor has a good experience, and we are giving the best possible service to the people that we support. And we let the participant know if there's anything that they need beyond that first mentor, they can call us and be rematched or get additional support. So thank you on behalf of ABCD. I really appreciate your time. And now I want to introduce you to Dale Semler.
Thank you, Betsy. Welcome, everyone. It's my pleasure to speak to everyone today about SHARE cancer support. Next slide, please. SHARE is a national nonprofit organization that supports, educates, and empowers women affected by breast, metastatic breast, ovarian, or uterine cancers, with a special focus on medically underserved communities. Our mission is to connect these women with the unique support of survivors and peers, creating a community where no one has to face these cancers alone. And just to insert a note here, what you call mentors, or what's been discussed as mentors, we call them peers. just to confuse everybody. Our outreach programs have made us a recognized leader in breast cancer support, and our metastatic ovarian and uterine cancer initiatives are at the forefront of the advocacy landscape. All of our programs are grounded in the needs and insights of real patients and survivors, and are developed in multiple languages so we can support women of all ages, cultures, and ethnicities to enable them to make informed decisions about their health. Our services are provided in both English and Spanish, and we have expanded our services in Japanese. These services include national helplines, support groups, expert-led educational programs, community outreach, online communities, corporate education, local advocacy opportunities, caregiver support, and survivor patient navigation. Next slide, please. So I just wanted to give a quick history of SHARE. Back in 1976, a Dr. Eugene Thyssen, who was a doctor specializing in breast cancer, realized that survivors of breast cancer might actually benefit from supporting one another if they were in a social setting. So he got together some of his patients for his first support group, which consisted of 12 women, and so began SHARE Cancer Support. In 1978, the group incorporated as a nonprofit. Over the years, this group has expanded its outreach and developed new programs, helping thousands of women and men affected by breast cancer. SHARE Cancer Support added helplines and educational programs and began to advocate for legislation for funding to fight breast cancer. In the late 1980s, we started Latina Share, which was to provide support, information, education, and advocacy opportunities for people who feel more comfortable communicating in Spanish. In the 1990s, we added support for metastatic breast cancer patients. In 1995, SHARE Cancer Support began offering services for women dealing with ovarian cancer. In 2013, we added Japanese SHARE, serving Japanese callers on the East Coast, and we have a heavily served population on the West Coast as well. In 2020, in the midst of a pandemic, SHARE began offering support for women dealing with uterine cancer, and they just celebrated their successful one-year anniversary. Next slide, please. So what services does SHARE offer? Well, there are 4 SHARE helplines: breast, ovarian, uterine, and metastatic. They're available 6 or 7 days a week, depending on the helpline, and they operate from 9:30 a.m. to 9:00 p.m. Eastern Standard Time. All calls are answered by volunteers who have had a cancer diagnosis themselves. SHARE is recognized for our peer matching program. Currently, we offer peers for all the cancers SHARE serves and have translation available in 25 languages. There are over 35 peer facilitated support groups. Post-pandemic, those are being offered through Zoom and telephone, and maybe one day we might be able to meet back in person. That is something we shall see. We have free educational programs and webinars led by industry experts. We also offer workplace seminars exclusively for our volunteers and staff. We offer outreach by trained ambassadors who target our underserved Black and Latino communities to help close the gap in the healthcare disparities that are found in this group. And as previously mentioned, our programs are offered in Spanish through Latina Share and Japanese through Japanese Share, and the SHARE website has links to both of these program websites. Next slide, please. So what does it take to be a volunteer at SHARE? Well, there are 3 main requirements. First, a volunteer must have had the cancer of the helpline for which they wish to work. Second, they must be at least 1 year out from their diagnosis, as we have found that a volunteer too close to their diagnosis can be triggered by some of the callers. We offer, sorry, just lost my place. We offer webinars, and they're led by industry experts, and we offer workplace seminars exclusively for our volunteers and staff. Sorry. Went back to the slide. We offer webinars several times a year, and as a series we call Support the Supporter, which for my group are specific to breast cancer topics. We ask that volunteers attend at least 4 of these programs throughout the year, as their third and final requirement. So what training is required? Volunteers for the helpline, as well as volunteer peers, are required to attend 3 two-hour classes. The first class is an introduction to SHARE, do's and don'ts of speaking with callers, sample calls that we critique, how to handle difficult callers, what to do if we feel the caller is in crisis, where to find information about other concerns such as financial assistance, transportation, free services, and the like. We train our volunteers to use the right track model of patient navigation, which ensures that callers have the right care team, the right tests, and the right treatment to improve overall outcomes. The second class is what we call Breast Cancer 101. We teach about breast cancer types, stages, tests, genetics, genomics, treatments, surgical procedures, clinical trials, and so on. It's basically everything you need to know about breast cancer, but we're afraid to ask. We're going to tell you. It's an intensive class about the science behind breast cancer. And finally, the class number 3 is database training. So we teach how to enter a caller profile into the database, how to enter the actual call information, how to schedule follow-ups, how to conduct peer matching to make sure no calls are lost in the process. Once the 3-day training is completed, the volunteer is assigned a mentor, which in our case is just somebody who is already a volunteer. The mentor is a senior volunteer who we hand select to match with our new volunteer. The volunteer will listen to several calls received by the mentor over several helpline shifts. Once comfortable, the volunteer will then take calls with the mentor listening in, so the mentor can offer live help for the volunteer if needed. The mentor will monitor the calls for accuracy, proper database entry, whether follow-ups and peer matching are handled correctly, and so on. Upon satisfactory completion of the mentoring program, the volunteer is ready to sign up for shifts. Since the breast cancer helpline has the most calls by far, it's divided into 3 4-hour shifts each day, while the other helplines have 2 shifts per day. Volunteers can choose to work the helpline, be a peer, or do both. There is no minimum requirement for how often a volunteer works the helpline. We are very flexible and appreciative of the time each volunteer can give us. We pride ourselves in our peer matching services. Peers available for one-on-one mentoring. If a volunteer feels their caller can benefit from a peer match based on age at diagnosis, stage of types of breast cancer, treatment protocol, or any other matching the caller requests, a peer match will be made. Our new database provides matching on the criteria specified by the caller and will automatically bring up all peers that match, listing them in order from the most matches to the least matches in common. The database will also provide information on how many callers a peer is currently working with, so we can distribute the matching and allow our peers more time to focus on their mentees without being overwhelmed. Next slide, please. We are excited about this partnership with LBCA. It's good to know we are all here for the same cause and for the same goal of helping people stricken with cancer. Through SHARE's helpline, lobular breast cancer callers can be matched with approximately 12 peers who have had lobular breast cancer. Over the last 2 years, we've helped approximately 100 lobular breast cancer callers, though this number is most likely much higher, as our old database may not have correctly differentiated all of the lobular callers from other breast cancer callers. Our new database is a functional database and will allow for extensive queries for more accurate and useful data collection. And since I'm heading up the new database project, I've been included on all operational meetings to provide direct input on what is needed for each helpline so there is no middleman. The engineering degree is finally paying off. Next slide, please. If you have any questions or if you're interested in becoming a volunteer for one of our helplines, please contact me. My contact number is listed here, and you can also contact us anytime through our helpline. You can be added to our volunteer list to be included in the next training opportunity. Next slide, please. No one should have to face cancer alone. We're here for you at SHARE. Thank you, gracias, and arigato gozaimasu. And now I'm turning it over to, I believe, Colleen.
That is correct. Thank you so much, Dale.
Welcome.
And to learn more about any of these opportunities, I'm sure some of you were writing down as you went as well, but to learn about the various volunteer opportunities from LBCA and then also the specific opportunities with ABCD and SHARE, here are the websites that you can go to as well. So what I wanted to do is take a moment to say thank you to Betsy, to Dale, and to Lori. And we are going to pause for a minute to stop the recording, and then we're going to answer your questions in just a moment.